Now, COPD is not only a disease here that is important here in the United States. It's an issue worldwide. This is actually a study that was being presented. In the dark blue, you will see the number of people with undiagnosed COPD in different parts of the world. The light blue is the number of people diagnosed with COPD. I have different countries here. I have Spain, I have Poland, I have Venezuela, I have Sao Paulo, I have Uruguay, again Spain. But look at these numbers. The number of people undiagnosed is really high throughout the world, and the same thing is happening here. Actually, the United States is one of the leading countries in the world trying to address this issue. 2010 is an important year, and I will tell you why later in my presentation. Again, this is the figure. 50 and 50. Most people don't know that. Actually, it's estimated that the number of people undiagnosed could be higher. But the real statistics show this. Now, let me tell you a little bit about what is the challenges that we have with diagnosis and the physicians. A survey that was conducted was conducted for patients and with physicians. And I just want to show you some interesting numbers of the survey. Over here, you will see the physicians that were primarily responsible for the care of COPD patients were mainly primary care physicians. The numbers show 62% of those patients were being taken care of by family physicians. So that's an issue that we have to address here in the United States. Most family physicians are taking care of the COPD patients. But look at this. Look at the survey among physicians. The physicians say that, yeah, in the regular practice, on average, they have 12% of the patients have COPD. But look at this number. This actually shows the percentage of professionals who are aware of the guidelines for treating patients with COPD. So we have that most patients are being treated by their family physicians. However, almost 50% of those physicians don't even know about guidelines for treating COPD. So this is not only a problem that we have to address among the general population about knowing about COPD, being aware of COPD, but also among our physicians. So what is it that our physicians think about COPD? And this is an interesting result, because all of these statements are false, but this is what they think. 78% of those physicians thought that COPD was a disease of men. And like I told you, COPD is more common in women than in men. 61% said that COPD usually started at the age of over 60. And again, that's false. Only 15% believe that COPD treatments are useful in relieving symptoms. And those of you who have COPD, who are being treated, you know that treatment helps. And it actually helps you improve your quality of life. Only 3% thought that pulmonary rehab was beneficial. How many of you are in pulmonary rehab right now? Shame on you, not too many hands. You need to go to pulmonary rehab. Pulmonary rehab is one of the best things that COPD patients can do, and they should be doing. Now, there is a challenge in the United States. Why? Because usually there are not too many pulmonary rehab centers. One of the issues is because Medicare and Medicaid wasn't paying for pulmonary rehab, and that's something that is changing at the national level. But pulmonary rehab is very important. However, only 3% of the physicians it is important for COPD patients. 33% had difficulty differentiating between asthma and COPD. So 33% of the physicians thought that asthma and COPD, yeah, they look alike, they're similar. Well, treatment is different for people with COPD and for people with asthma. And that's a huge issue, because we need to address that. You need to identify when a patient has asthma and when a patient has COPD. Do you know how you can do that? Anybody has an idea? It's very simple. It's about spirometry testing again. So, for those of you who use inhalers, there is something called bronchodilator. It's one of those inhalers that opens your airways so you can breathe better. Every time that you use that inhaler and it's opening your airways, and it opens right away, then you have asthma. If the response to that inhaler is not very good, you have a diagnosis of COPD. So it's very simple to do. Physicians don't know about that. This is some other important information about the knowledge of the physicians that are treating patients with COPD. 70% reported lack of confidence in detecting COPD. Many don't even know they can diagnose COPD with an spirometry. Studies that have been conducted among pulmonary offices have found that many patients are being diagnosed based on symptoms, but they are not being diagnosed based on a spirometry. 65% reported lack of confidence in diagnosing COPD. So one issue is, you know about the spirometry testing. Well, the second issue is, how do you read a spirometry result? So yes, it has different numbers, and those numbers shouldn't be an issue for you, but for the physicians, should be. And actually, this is a test, as you can see, many of you have done the spirometry outside of this room. It's very simple to do. You just have to blow into this little machine. Yes, I know it can be difficult. I've done it and it's tough. But it can be done in a physician office. So we really hope that one of these days, every physician will have an spirometer in his office. Now, knowing the challenges, what is happening around the nation, there have been some studies being conducted to try to see if we can find an alternative so we can at least promote better diagnosis in physician offices, so at least the patients can be referred to the pulmonologist on time so they can establish the diagnosis. 66% of the physicians reported lack of confidence in managing COPD. Again, they don't feel comfortable treating COPD. Now, spirometry is very essential for the testing. If you have symptoms, and you know the symptoms that most people have are not only for COPD. When you have difficulty breathing, you have shortness of breath, you have cough, that doesn't mean that you have COPD. That could mean different conditions. That's when you have to also evaluate exposure. Do you have any risk factors for this? Are you exposed to cigarette smoke that will actually lead you to develop COPD? Probably yes. But if you have those things, you have to get the spirometry done. Now let me show you some of the studies that were conducted among patients. When you do the patients, and we have this cohort of, I think it was over 3,200 patients. You have that 728 patients had lung symptoms. When they had spirometry testing, we found that 18% of the patients had actually COPD, had obstruction in the spirometry testing. When we took the patients that did not have any respiratory symptoms, they felt good, they didn't report any symptoms, we still found 4% of those patients with COPD. So sometimes you won't even have the symptoms. And that's why we classify COPD in 4 different stages, stage 1, 2, 3, and 4. But it's difficult. So sometimes you're just assuming you're getting older. That's why you have difficulty breathing, because that's how we age. But that's false. You shouldn't have any difficulties breathing. Look what happened when we use spirometry testing in the medical facilities. This is how people were being labeled before doing the spirometry testing. Asthma 30%, COPD 29%, other 39%. After doing a spirometry testing, this is what we found. 64% of the people with COPD and 33% with asthma. So that is telling you that spirometry testing needs to be done in the community.